All right. Last month there was a anarchist gathering, and there was a mental health panel with folks who were either working in that field or have a lot of experience with it and stuff. I brought my video equipment and everything there. I recorded it, but nobody was using the microphone, so it did not pick up the audio. So would you like to share what the panel was about?
Yeah. Well, I can really more go over an overview or a simplification of what we did talk about. The panel lasted for about 2 hours, so, to surmise everything's pretty difficult. And also I was introduced to a lot of new ideas that I wasn't really aware of before. We discussed the mental health system in general, how, I guess, mental health professionals, really assess and handle people in crisis. We talked about 5150 holds, which in our system of mental health, it's an involuntary hold or a voluntary hold for up to about 72 hours if someone has basically made a threat or attempt to harm themselves or others. And, it can be willing or unwilling. If it's unwilling or willing, actually, it usually ends up with a hospital visit to psychiatric emergency services. And sometimes it can be just via an ambulance or just ending up at the hospital some way, somehow. There's also the more aggressive, violent, and disliked alternative, which is with police escort. Talked about that. We talked about the history of mental health really being based on racist ideology, like epigenetics, how it was developed, with categorizing people in certain terms. We talked about, actually, what can we do to support people in the scene, in the activist community, in the anarchist community, when they are dealing with mental health issues, finding alternative ways than the current system we have, because it can be violent, it can be oppressive. There's different opinions. We definitely had members of the audience who shared their personal anecdotes on their own experience with crisis and mental health issues, personal problems they're going through at home, or knowing a friend that might be going through something. So we talked about so many different things regarding it, but those are the ones that really stand out to my remembrance.
Also, what is that? I want to first congratulate you because recently you became a supervisor, but what is that you do in that field for work?
Well, my role that I had been in for about 4 years now was as a mental health substance counselor in a 2-week program, which was it is called an acute diversion unit. The word acute in reference to more mental health crisis. We get a lot of people from the hospital directly or from the clinic next door to us. They've either endorsed recent suicidal thoughts or a recent attempt, or if it's not necessarily that severe, then people who are going through depression, grief, high anxiety, psychosis, people who haven't been on their medications. We got a lot of people who've had a lack of housing, and people who need time to stabilize so they can get back on their feet or connect to things, connect to the community better. So I was doing that for about 4 years, and I just got promoted to being one of the assistant directors of the program. So my role is really going to be a supervisor to the counselors and training and helping our clients route to maybe longer term programs. So we'll see how that goes.
Here's a really interesting one. It was a while back. Somebody brought this up. You also work with people who has alcohol abuse problem and drug abuse problem, but you're straight edge. You don't do that kind of stuff. So how would you respond to somebody who would say, you never used drugs before, you don't know what it's like? Because we both don't do drugs and stuff, but how would you respond to that? Somebody would say, you never shoot up before, you never did cocaine before, you never done that. How could you help me? Because from what I understand, a lot of people who do that kind of work, they were former once drug user. Am I correct? Or,
Well, there's different categories or types of counseling and programs. Ours is more mental health, really. But obviously, comorbid is mental health, substance use. The substances can range. It's alcohol, methamphetamines, heroin, opiates, pills. It's a whole slew of things. But obviously, if you've had your own experience, you have more rapport with your clients. So you might build a better connection. You might already know and have access yourself resources that have helped you and that vouchers for what you are speaking on. But for someone as myself or yourself who haven't, we haven't really delved into that type of lifestyle, those coping tools, really, and most of the time maladaptive coping tools, you never really know until you walk in someone's shoes. But as intelligent people, I think, based on observation and really learning from other people and observing, you can see, the type of consequences that do come from sometimes using substances to an extreme way. I don't want to necessarily stigmatize substances. I understand why people might resort to using substances in certain contexts. That's why I don't want to demonize or put people down for using them, because, our pharmaceutical companies and our society, it's always take a pill, feel better, and that can be from something as minor as a headache to treating psychosis. So there are some people who, depending on the type of treatment they need, maybe medications is the answer. And, medications are expensive. They aren't always available, or someone's not really in the right frame of mind to even have the skills really to access medications through a hospital, through a doctor. So resorting to chemicals or substances on the street when they're more readily available to help cope with their symptoms, it seems to work, at least for a time. But obviously there's consequences, physiological consequences, social consequences. But yeah, I do feel I have the ability to still support people, even if I haven't really delved into that myself. I can still understand and see, the consequences of that, and how, treatment can be possible through a counselor like myself, a mental health counselor, because mental health, does connect very closely with that.
what's your opinion about some organization, instead of telling people to stop using drugs, they give clean needles and say, if you're going to shoot up, don't do it alone, do it with a friend. What is your opinion about that? Because I kind of have mixed feelings about this. Instead of people to stop doing drugs, giving more clean needles and saying do it with a friend.
Yeah, that's like the needle exchange programs. You notice in San Francisco, especially as you're walking around, there's a lot of needles on the floor, used needles, which is hazardous. It's a biohazard. You can get pricked with one. You might end up with some kind of disease or being injected with some kind of substance, and who knows. There's a lot of problems with that, but that's really a part of the harm reduction model. So it's less of harm idea that, say you have clean needles available, basically take your dirty needles, turn them in, get some new needles that are clean. It may reduce disease. It may reduce, problems with injection. People don't know how to use their needles. So it really might help people, if you're really more humanitarian centered, more focus on helping people, that, it's kind of addressing the branches of the tree, not the root of it, so it's not really going to correct people or stop people from using substances or reduce people's use of substances. I don't think it's not really the goal of it. The goal is mostly just to reduce the chances of spreading disease and spreading bigger harm. So yeah, it seems almost as if giving out needles is endorsing drug use, it's supporting drug use, but the intention behind it is not necessarily for that reasoning. It's just more to reduce other issues.
Okay. Me and you had some little bit of disagreement on mental health. What is your opinion? People who have, this is my opinion. Sometimes I meet people, I don't think they have a mental health problem, and they use that excuse, saying that they have mental health problem and they do domestic abuse or hit their partner or be really verbally abusive, and they blame it on mental health. And they always do that. I don't like that. What's your opinion? How do we deal with folks like that?
Yeah, really in general, if someone has a behavior problem, how do we define a problem? A problem's something that you personally observe of yourself or others observe from you. So being in a position of being the abuser, to look at someone, understand why they may be doing those types of behaviors, that would need therapy. That would need to delve into that. Where, do those urges come from? Why do we see these patterns in people? I think it's a person's responsibility,
right,
when they do have those types of issues, to seek treatment, to seek the therapy, to understand themselves better, build the insight, and change their behavior patterns, change their thought processes. That is all through treatment. So as a responsible adult, really, that is something people are responsible for. So is it excusable? Is it mental health? Our mental health is a status. You could be in good mental health, bad mental health, or, there's a whole category of diagnoses you can have. But people who are committing acts of violence or, abusing people, I mean, that really comes to, it's hard to say. Is it mental health? Is it just lack of morality? Is it maybe temporary, behavior? So it's very individual to the person. It's really going to depend. I don't think there's really a clear answer for across the board to answer that.
Interesting. Okay. Why is it, my other question I have is, why is that in like third world countries, people are struggling and they're doing whatever they can to survive, but here in America, like, why do we have high rates of suicide when we have so much resources and everything? Why do people get depressed so easily? And sometimes I gotta watch what I say because people are so sensitive. It just scares me. Why is that? And the recent suicide, which I'm not gonna go into details who did it, who, like, it's constantly going on. Why is that?
Well, I think a lot of it has to do with culture. In the United States, a lot of it is pushing, a lot of our media, a lot of our societal norms pushes individualistic lifestyle, a lot of be your own person, get your job, start your own family, do this and that. It's a very lonely, if you want to say, or isolative style of living, and your relationships are more built on being superficial. It's more like network. A friend to maybe help you connect to this person, or maybe you just establish that friendship because it might be a way to get to another job or something like that. It's unfortunate that the culture here breeds that in a lot of third world countries, if you to use that term. In a lot of places around the world, their culture is based on the community, based on family dynamics, based on large extended families all living in the same home or neighborhood. And to have that kind of support and structure, that's the thing, is people aren't as isolated or lonely, and they feel a lot of support from family, friends, and their communities. And a lot of the issue comes to resilience and building resilience. So there's theories, on why do people seem less resilient than others, and it comes down to sometimes the way they're raised as a child, even if you want to say, not to get so deep into childhood dynamics and how it affects your adulthood, but it's kind of the theory of the spoiled child. If they're always receiving what they like, and they're not told no, they're not really building the skills of being rejected, not building the skills of being told no. They're not seeing how it in time, really, to build the awareness that those heavy emotions, or those types of emotions of being disappointed, do come about. And the more you're exposed to that as you're growing up, the less severe and impacting they're going to be. So in places of less, I guess, privilege, if you want to say, or resource privilege, they have to face no every day because they don't have access. So I think that does help people evaluate too, how to handle being, told no and being disappointed. And that doesn't necessarily lead always to, wanting to self-harm. Here, yeah, you do see self-harm more often, and it could be related to that. Hard to say. It's very complicated. Everyone's different, but it's a theory.
Yeah, it's hard to bring this up again. It just blows my mind because we have so much resource in this country. People get so depressed and get on all these pills and everything. But maybe I don't know. Maybe because we're in a whole internet, in the internet thing, there's internet bullying. Maybe because of that, also capitalism. People can't pay to afford rent, and they get too shy to ask friends to help for money because they have pride. Maybe because of all that stuff as well too.
Yeah, it comes back to the competitive capitalist, keeping a good face, putting on that fake smile, take a pill, be happy. That whole idea behind it too. I mean, there's a lack of substance in the happiness that people may portray. Online there's a lot of talk now of, how people are presenting themselves and the wealth they're showing, their happiness, if you want to say. You're getting a snapshot of someone's life, or maybe a really structured and picturesque idea of the lifestyle they're having, but behind closed doors, off the internet, there might be a lot of turmoil, there might be a lot of loneliness, there might be a lot of isolation. So we don't really know, and that is becoming a more and more increasing issue. And seeing that, I mean, why do movie stars or very famous people, we're seeing a lot of suicides with a lot of people in that industry.
Rich people too.
Yeah, rich people.
A lot of rich kids and all that too.
So wealth is not necessary. It doesn't bring happiness, and that capitalistic competitiveness doesn't equal happiness, and the lack of happiness can lead to depression. It can lead to suicidal thoughts, and then maybe a suicide action. So,
I also think internet bullying too. So, another thing I want to mention, we're not going to mention our friend's name who used to live here. He was saying that in Oakland, he was so scared to get into activism because he was saying that if you don't agree with somebody on certain political issue, they get angry at you, they call them racist, they call them sexist. So
the political correctness.
by doing that, a lot of people got turned away from activism as well, even from anarchism too, from just normal anarchist activists, non-punk anarchist activists. People get scared now. How do we deal with people like that? We can't even sit down and say, hey, I don't agree with you, this and that. Why don't you agree? They get all mad.
Well,
how do you deal with folks like
I look
that?
at it like this, to educate yourself on proper pronouns, or the way to categorize, or the way to address, certain groups with the words or the names or the presentation they would like. That takes time. It takes education. It's going to take mistakes to happen, and that's the thing. The community, should be patient. They should understand not everyone's necessarily going to have those skills already inbuilt, and when people do maybe not use the correct terminology or the right name, as a future, point really is that people should exercise a sort of awareness or benefit the doubt, if you want to say, around the person's intentions. If someone mispronounced someone else, it's not necessarily because they're trying to be transphobic, for example, or they're hateful towards that group, but it may have just been an honest mistake. And then,
or doesn't agree with them politically.
Yeah, and that's the thing.
That's the major one too.
As they say, really, in general, like when at work or at school or wherever you are, to avoid, a few categories of topics: politics, religion, culture. Those are usually the really taboo ones. But those are things we can talk about, and there's a way to talk about them. There's certain skills, social skills, really, that are in place where you can have a good conversation, a peaceful conversation, without offending somebody and putting them down directly or indirectly, really. And to disagree with someone, there's always that place you can get where you can agree to disagree. So not everyone's gonna like your personal opinion, but to talk about it, if you really feel that you're coming from the correct place or the most educated place, people should have platforms to talk about that and not feel that they're going to get ostracized or, face, judgment and being pushed away. I think that's unfair.
Okay.
Yeah.
Another thing is like suicide. How do we deal with people who are suicidal? Because my opinion, like people have different opinion. People are suicidal and stuff. I find like people who do suicide to be really selfish and stuff. It makes me really angry because I have past in my family, my close friends. I could go on and on, but sometimes you could do so much, you just cannot do. Only they could change it. No matter how much you talk to them, it's like talking to a wall. No matter how much you try to help them, if they don't want to help themselves, I mean, how are we supposed to deal with that? People are so depressed and suicidal. How do we deal with folks like that?
Yeah, it's difficult. People lose a person that they value and they care about. I always emphasize this point. It's a very simple idea, but it's obvious that when someone does commit suicide, that is usually a result of their personal pain. They couldn't handle the context of their life anymore, their emotion anymore. But that pain that they wanted to get rid of is literally being transferred to those who love them around them. And it feels unfair. It feels like they're being selfish. They're burdening the people around them with that very emotion that they wanted to escape. It really is a personal choice. People have the right to choose to, legally not in California, but to end their life. But technically, yeah, if someone really wants to do that, they will. And, it's, for me, I say it's really God's will. If, people do choose in the time they do, and their death is, only known to Him. But it's hard to say. Should we support people to make that choice if we could stop it, right? It's, it definitely comes to an ethical thing. I mean, people have a human right to choose. It's literally their life. But if you want to go in the religious perspective, which of course is not everyone's opinion, but, their life was given to them. It wasn't necessarily theirs. It was, yeah.
The reason I bring this up is people who do that stuff, they hurt all their families and friends around them. That's why I said selfish. And if they have kids, my gosh, can you imagine what the kids have to go through for the rest of their life? Or even the close family and stuff. That's why it makes me so angry. Like, I think like 10 years ago or something, or 8 years ago, I posted on my Facebook or something. I said, this is the last funeral I'm going to go. Whoever commits suicide, I'm boycotting all fucking funerals. Even if it's a close friend, because whoever does it is fucking selfish. I ain't going to any more funeral. People with suicide, so I post. That's why.
It makes sense to me.
It
can be looked at as, it's really a transference of what they went through to you.
Right.
But
so what's the best thing we could just listen? Just keep our mouth shut?
The best thing you can do is definitely be their support. If they want to talk about what they are going through, hopefully they will. There will be at least indications or signs.
They just fucking hide it too.
That can happen. That can happen.
They just fucking hide it.
Well, that's why it's always important to share a message. If someone's not actively speaking about it or reaching out to their social supports, but at least, videos like this or, these discussions, it helps maybe introduce people to awareness that there are resources, there are ways to privately disclose that information. There's a suicide hotline. There's groups of people, even online or over the phone, wherever, or even in person, that you can talk to, support groups and things. Also, get a therapist, for example. They're not family friends, so everything you say is in confidentiality. So really, the only thing we can do with people who don't necessarily want to share is just inform of resources and hope they utilize them.
Can I also tell you something blows my mind? Okay, you got your degree at UC Berkeley, and there's like therapists or psychiatrists. So, okay, I'm going to just change the subject really quick. Anthony Robbins, aka Tony Robbins, he wrote in his book, he didn't go to college or he didn't have that kind of training or anything because he does his own training. What did you opinion about him? A psychiatrist helped this man for so long, he just gave up on him, but Tony Robbins just changed him without any background of any training or anything, because he believes like if people really want to change, they could change.
Yeah, there's different ideas behind that. Well, first and foremost, psychiatrist is mostly going to be focused on more clinical, the medication side of treatment. Tony Robinson,
He goes by Anthony Robbins or Tony Robbins. He put out a few
Sorry.
books.
Okay, Tony. Okay, well,
He's
Mr.
interesting.
Robbins, yeah.
Very interesting guy. He changed a lot of people though.
So
Without any those formal psychology education. I don't know. He didn't go to college for or anything. He just does amazing stuff.
That really comes down to probably rapport, which is what we talked about earlier. Maybe that individual connected to Tony in a certain way. Maybe Tony's experience resonated with him, and it didn't necessarily take one-on-ones with a therapist to hatch out things or explore their history, but maybe Tony as a positive role model or someone to look at another type of lifestyle that they maybe thought, hey, I haven't tried this approach, I could do this, and that may have worked for some people. And throughout history, therapists and psychiatrists weren't always in existence, and people some way somehow got through things and sorted out their problems and issues.
I think in the old days, like in the old days before technology and industrial and all that, people had more tight community and stuff.
Yeah, culturally,
tighter family, cousin, relative, friends, they were more tighter. That's why they didn't have that much of what's going on now. But the future, good thing about the future events, I think like future punk rock shows in Los Angeles, like either I suggest you, Camille, whoever could set up a booth at punk shows, like have literatures about drug abuse, how to deal with depression, set up a booth, give like, free counseling, free tips, like people who are kind of homeless youth or become close to homeless, like what are those programs called? Like if you can't find a home, like shelters or whatever.
Yeah, it's
like
a lot
with
of that
all
is,
the information, we should start doing that.
Yeah, it could be a direction to go into. There's already.
I think Punk with Lunch kind of does
harm
that.
reduction.
Yeah, they do, but they do harm reduction.
They
they
give
do
out
really
like
cool.
naltrexone or
Yes.
Narcan, if you want to say, for people
and they have
who
the
overdose.
Narcans and stuff. But then that's really cool. But we should go further and put out literatures and stuff about dealing with depression, dealing with like blah blah blah. If you're having financial problem or dealing with homeless or like that,
Yeah,
and free counseling, tabling, so one-on-one counseling.
It depends. I mean,
do you think that's good?
I mean, it could be helpful
for people. Not me, but people who have experience like you, because I don't know what to say. Who have experience like you or your other friends and stuff.
Yeah, I mean, at a show venue though, it can be really loud and
like between bands.
Yeah, I would say being a counselor really teeters on, kind of going to therapy, if you want to say, and that's not a good thing necessarily, because for a very short duration you might get into this like pretty deep conversation with someone, but you can't be there long term. You can't make a future appointment to hold them while they're going through that emotion or that issue they were talking to you about. So yeah, as a resource, we could talk about maybe free therapy in the community, or more this like social work domains, but access to housing or 12-step groups if you're into that. Talk about NA, AA. So just introducing people to ideas, I think could be helpful at punk rock shows. Our punk rock community, if you listen to the music or see the community, there are a lot of people that do delve into self-harm and substance, and it's really in some way ingrained in punk rock culture, the majority of punk rock culture.
We need that in LA. I'm not going to go into details. We were both there. We saw that crazy stuff.
Yeah,
definitely need
I've
it in
seen
Los
it
Angeles.
over many years. There's 16-year-olds getting drunk. There's people on meth. There's people snorting cocaine. There's people shooting up. There's all of it at shows, either before, after, or during shows.
Or the violence.
And there's violence, yeah.
Verbal violence, right, and stuff we witness and stuff.
There's all of it.
All right. Time's running out. Let's how to deal with depression. We're gonna end it with that. I'll go first, and you could go first. Okay. I mean, you could go second. Okay. Dealing with depression. Every human being's different, but this is my opinion about dealing with depression. Everyone's different. It will work for some people, but some people it might not. But it works for me. Keep yourself busy. exercise, work out, and go to places where there's a lot of people. And especially if you're depressed, if you're in a breakup or someone passed away, don't watch any fucking sad movies. And be around people constantly. Don't and don't hold things inside of you. Get it out. Talk to people. You trust. And most importantly, you need to get rid of all the fucking negative people that surrounds you. Like people who always bring you down, energy sucking vampires, or people who are always fucking constantly negative or have always bad news for you. You got to get away from all that and be around, people who are like positive, or could be a role model, or you could learn from. Also, like, set short goals and find like a hobby and stuff. Because some people who break away from a relationship, they go crazy and jump into another day. They think by doing that they're gonna be happy, but if you're not happy with yourself, you can't be happy. I'm not gonna go into details, but that's my thing.
Yeah, the rebound.
So, what's your
idea.
opinion about dealing with depression? How could people deal with all that stuff?
Well, what you said already intuitively, that's pretty much a lot of coping skills. Check off the list. Reducing isolated behaviors. I would say that's the one that really stood out to me. And then exercise, endorphins and oxytocin, all those great neurochemicals that make people happy. Those are released when you do physical activities. Well, I would say beyond those types of coping tools, if you are dealing with depression, one thing that's taught in my, religion really is that, is to emphasize, leave your place, leave the environment. And that could be the negative people around you. It could be the substances around you. It could be maybe triggers, which is another term for that really. Leave those things, leave those places, take a break, take a step away, or just leave it completely. And and I was gonna, not to criticize the point you made, but negative people, negative, low mood people, no one's ever gonna be 100% negative or 100% low all the time. And maybe they need help too, but you can't help someone from drowning when you're drowning. I think that's the point that needs to be made there. They need support too, right? But besides that, seek therapy. That does help people. Medications, not my favorite go-to. I don't really want to emphasize the use of medication. I'm not really a proponent for medication.
I'm not into medication. I think meditation.
Meditation. Well, I mean.
Also, finding new hobbies.
Yeah.
Like if you don't play piano, get into playing piano, or if you don't play video games also like join like clubs. Like it could be yoga clubs. Hey, I thought you studied psychology, man. I thought you would go on and on. Come on,
you're saying a lot of the good ones.
Stuff.
So.
I don't fucking have any psychology or nothing.
You're still on good ideas, yeah.
I just don't understand. Okay,
yeah,
I'm just kidding.
I mean, honestly, there's even really online, there's lists of like hundreds of coping skills you can use, and a lot of that's included on there. Finding a hobby, find your niche, what you're good at, what you have passion for. Those things they're distraction techniques. There's the meditation idea is to help you ground, to help you, step out of that mindset that you're in at the moment.
And the last thing I want to mention is, like, people have financial problem, because I used to be poor, but my friends helped me. That's how I made it to I'm not going to go into details how I am now. I mean, I'm doing really good now, but people should express them, say, hey, I'm doing bad, I need financial help, to the friends that they could trust. You know what I mean?
Yeah.
They should not hide that. It makes me sad. People hide that stuff and all that.
Financial stress, I mean, that's, I'm thinking about the Dust Bowl in the United States. Many years ago, the United States was going through, financial crisis and debt and everything else, but a lot of, homeowners and a lot of men, and families committed suicide. They left their families behind because they were just drowning in poverty.
They had the fucking manhood. to ask for help.
Yeah, that's the thing. Getting a job too, or working, if that's
crazy.
something available, volunteering, all those things that will bring you more social connectedness to your friends, your family, your community. Very important factor of reducing symptoms of depression.
Right. People need to get rid of that pride thing, especially guys. They have the whole pride thing and they don't want to tell the problems, so it like tears them apart inside.
Well, that's a whole story
lot.
talking about men in our society and the issues and problems that come along with misogyny. So, yeah, a lot of men don't. And that's why we see a lot of men in the mental health system more than we do women actually, and men dying younger statistically because they're resorting to maybe those unhealthy maladaptive coping tools, and that may include substances, for example, and that impacts their health. So. That's a whole issue talking about that, but
Yeah, I mean, I'm not a counselor. I'm not into really, counseling people. You're more into it, but I just wanted. Life goes always up and down. It's not always perfect.
yeah,
I mean, it
it's
could
an
go
experience.
Low,
Anything's an
really
experience.
up, low, and like really up. It's always up and down.
It is, yeah, it is. That's the nature of life, and everything will pass. Everything is an experience. A lack of housing is an experience. Depression is an experience. It isn't. If you are diagnosed with a mental health disorder or an illness, if you want to say, you're not the illness, you're not the diagnosis, you're still a human being, you're still someone who has a lot of potential, who, will be successful and can be successful, and,
right.
Being challenged with something like that, there's still hope.
Can I say something though before we go? Okay, so some of my friends, they keep telling me I have mental problem. I don't think they have mental problem, but if you keep saying you have mental problem, you're gonna really have a mental problem.
Well, it's
I mean,
more looking
I don't think
why
some people don't have mental
why
problems
they're
like
saying that. Yeah, I mean that people manipulate systems, just to access certain resources sometimes, and saying, okay, I'm suicidal, for example, may gain you entrance into the hospital, and from the hospital maybe to some housing resources. So there's different reasons people might say that, and maybe that's really not what they're going through, but we should look at why they might be, what's behind it.
What's the root of it?
Yeah, what's the root of it? Because
what
obviously
makes
that's
you
a behavior. So
what makes you think that is, or it could be,
and that's true too. Yeah, maybe
it could be the environment they grew up, or the people they're around, or something happened in the past with their childhood. It could be anything. So
it could be, yeah, and
yes.
People.
Or what they saw.
Yeah, back in the day, people didn't even want to acknowledge mental health issues existed. They said, yeah, if you're sad, get over it, walk it off. That's nothing. I've been through worse. But as said, people have different resilience. People have different backgrounds and experience. So it's always going to be individual. Always meet people where they're at. Take them for what their word. If someone's saying, I am dealing with this, okay, how can I help you? Obviously, you're saying that for a reason. Let's explore how I can help you, or refer you somewhere or someone that can help you, and do your best.
Right. Okay, that's it. We went over time. Thank
Okay,
you.
sure.
Thank you for the interview.
You're welcome.
All right. Thank you for all the work you're doing too, helping people as well.
Well, thanks, you do too.
I don't do any of those stuff.
Well,
All right.